Hey guys, Nurse Kat from NCLEX Mastery, back with another cardiac question to run through. It's a select all that apply, so get your thinking caps on. Don't forget to comment download in the comments to get the #1 test prep app for NCLEX in the App Store. And don't forget to drop your answers, comments, questions in the chat. Of course, I might not be able to get to all of them because I'm focused on the live, but we have a team and they're in the chat and they'll help you work through things as we can, okay? All right, so a few things to think about as we're going through this question, okay? First of all, when you get to the choices, this is a select all that apply that didn't tell you how many to choose. It could be one of them, it could be all of them, and you need to treat each one like a true or false. Then we tell you to rephrase the question. It's a big question. You need the information that's in there, but what's the gist of it? You've got a person going down for a stent placement for a cardiac issue, okay? And they've got medicines due, and you've got questions about some of these meds, okay? At least one of them, maybe all of them. So how do we know which ones we're concerned about, okay? If it was a typical surgery or a surgery where the bleeding risk was high, we might be really worried about them being on aspirin and clopidogrel, right? Okay. Then we've got blood pressure medicines and we've got our anti-diabetic medicine. What are we worried about and why? Stent placements are not typically long surgeries. Remember, drop your comments, drop your thoughts, drop your ideas. Okay? And this is pretty true to real life. You know, you're staring down a list of probably many more medicines considering this person has metabolic syndrome, right? Metabolic syndrome, they've got high blood pressure, usually obesity, diabetes, like it's a whole ball of comorbidities. So you're probably on a whole lot more than 5 medications, but this is where we are. All right. So what are we holding and why? And of course, you're clarifying with the provider. Nurses don't typically hold medicines on their own, especially right before a surgery. So we need to make sure that the provider is who we're consulting about these medications. So the actual problem with this surgery and any of the medications is the contrast dye. It's totally normal for this surgery to be an MPO except meds. But this is a heart surgery that comes with contrast dye, okay? So we're actually not worried about the aspirin or clopidogrel because those are part of the therapy that they are supposed to be on for this procedure, for the issues that they've come in with. So we're probably not going to want to hold those. Those were probably written for when they came in really specifically in order to prepare for this surgery and make sure that they wouldn't clot. Amlodipine doesn't have any negative effect one way or the other, but what we're worried about with metformin and lisinopril is the way that they will react in the body when the body's getting contrast dye. And in both cases, we're a little worried about the kidneys, and for lisinopril in particular, it can cause their blood pressure to drop in combination with the effects of the contrast dye. So we want to make sure that they actually want to have those. Now in practice, it is never wrong to clarify. If you have any doubts or any reservations, you can always ask the provider what you should or shouldn't be doing. This question is really making sure that you understand what you should be worried about and why, and making sure that you're not going to do something that's completely unsafe, like giving all of those medications without making sure that the doctor wants the patient to have them, or even worse, holding them all just on the basis that the patient